All right, guys, Dr. Jesse Cease here with Health Fit Chiropractic and Sports Recovery in Boca Raton. We're going to stick with the triathlete theme. A few weeks ago, or for the past 2 weeks really, we've been focusing on hip injuries in the triathlete. Today we're going to stick with the lower extremity, but we're going to move down a little bit into the calf, outer leg, ankle, foot region really. We're going to cover with this. Our kind of main focus to this video is going to be a muscle called peroneus longus, okay? It's a muscle that's on the outside of the front of the leg here, kind of right below that fibular head, and comes down behind the ankle and wraps underneath the foot. So it's very important. It attaches kind of like right underneath that big toe. Very common site of trigger point buildup, of just cause of injury throughout the lower leg. Okay, so it's always a big area I look at when it comes to treating any injury in the lower leg, whether it be plantar fasciitis, pain in the big toe, in the ankle, anywhere really below the knee. I'll take a good long look at this muscle. So first thing I always like to do when I'm examining the lower leg, again, we see this a ton in our triathletes, is I always want to look at the extension of the big toe. If you're not very good at this motion, extension of the big toe, it's not going to be easy for you to actually contact the ground in a correct, efficient biomechanical way, right? So which can lead to injury. So the first thing I'll look at is big toe extension. And we want to see about 60 degrees of big toe extension. That looks about good there. So, but if you're lacking there, that could be a major factor in leading to pain up into the lower part of the leg. Okay, up into the lower part of the leg. It's a little bit of an oxymoron, but we'll go with it. So ART, which is kind of what we're focusing on in this video for this peroneus longus, this outer front side of the calf muscle, if you will, in layman's terms, is very tricky at times, but we'll show you how it's done. So what we're going to do is we're going to have you start with your foot down and out like that, okay? And then when I say go, we're going to go up and in like this, okay? So again, anytime we're treating ART, we're shortening the muscle, and the job of this muscle is to evert the ankle, or evert the foot, I'm sorry, or also drive the ball of this big toe, kind of this area of the foot, right into the ground. So if this muscle is weak, you're not going to be able to really drive that part of the foot into the ground, okay? So you can see as I'm shortening the muscle, that's the position I'm having her in. Her foot is down and out, okay? So this is the job of that muscle. Good. And then we'll go ahead and have her come up and in. Good. Good stretch there. Awesome. Good. Down and out. Up and in. Good. Down and out to up and in. Fantastic. Down and out to up and in. Good. Good. So we want to make sure, again, that your mechanics, your striking the foot to the ground mechanics are focused. The focus of that force is through this joint in the foot, right? That is proper foot mechanics. Another thing we'll look for here, sorry to turn my back on you guys, is to make sure that this joint here, that first ray, is moving properly. So this is a very good, effective move too, to help just to make sure those big toe mechanics are working efficiently. So I'm going to contact the top of the foot with a soft contact, not really pushing in. It shouldn't be uncomfortable. You tell me if it is. And I'm just going to push here, okay, and really try to get the motion through that bottom part of the foot, through this first joint here. We're dealing with soft tissue treatments in these videos for our triathletes because it's the most common presentation that we see, just overuse type soft tissue injuries. And again, we understand that you guys work these 9-to-5 jobs when you're not training, right? So it's hard to go from so active on your downtime, right, to being so sedentary in your work life, right? So what we want to do is we want to provide you with nice, easy exercises you can do while you're in the office. You can take to the office or at home with you, just to make sure that that downtime while you're working is not negatively impacting your performance as a triathlete. So we're going to, in our next video, we're going to give you some nice, easy, minimal equipment exercises to do to kind of help treat these types of conditions.